My name is Dr. Stephen Padgett. I'm the Physician-in-Chief at Hospital for Special Surgery. And I'm Dr. Thomas Skolko. I'm Director of Orthopedic Surgery at the Hospital for Special Surgery and the Director-in-Chief of the Surgical Arthritis Service. Tom, this hospital has been renowned for its multidisciplinary approach to difficult medical and surgical problems. Can you give us a little bit of an idea about the history of what was previously called the Comprehensive Arthritis Program and is now called the Surgical Arthritis Service?
Well, Steve, this is a unique service to the Hospital for Special Surgery. As you know, in many hospitals in the United States, rheumatology is here and orthopedic surgery is here, and often not a lot of collaboration exists. About over 30 years ago now, this service was founded to bring the two disciplines together to improve the care of the patients with severe arthritic problems. It is absolutely unique. At this point in the United States, I don't know that there's another service that works as closely as we do in dealing with the most comprehensive rheumatoid arthritic patients.
What is there about those patients that demands this type of an approach?
Well, as you know, rheumatoid arthritis is a disease that can affect multiple joints, both upper extremity and lower extremity. And oftentimes these patients in the past would get lost between the hand surgeon or the hip surgeon or the back surgeon. What we try to do on this service is deal with all the problems that affect that patient. They're very complex problems. They're complex in terms of the medications they're on. They're complex in terms of the rehabilitation. They're complex oftentimes in the socioeconomic issues that are accompanying this disease. So this service allows us to really deal with all those complex issues comprehensively and not fragment the care of these patients so that they're shifted from one service to another, or one surgeon or one physician to another.
Where did this concept come from?
Well, I think it was a concept that originated by a very far-sighted rheumatologist, in this case Dr. Richard Freiberg and Dr. Charles Christian, and Dr. Ramsey Straub, who was an orthopedic surgeon at the Hospital for Special Surgery. And they worked very closely together and saw a lot of patients together, and then sat down and felt that why not do this in a more formal, structured way? And that began what was called a Comprehensive Arthritis Program, which has now evolved into the Surgical Arthritis Service.
Now, as you said before, there are rheumatologists all over the country and all over the world, and there are orthopedic surgeons. Why has this not been exportable to other places?
Yeah. Well, it's interesting that you raise that question. I've asked many times the same question as I go from one academic center to another. And I think it may be somewhat of a feeling that each individual discipline has its own fiefdom, if you will, and that a lot of interaction does not often occur. I think certainly for the care of the patients, it's the ideal way to go. We have found it very successful here at the hospital. I think also it spills over into organizations such as the Arthritis Foundation, where I believe rheumatologists and orthopedic surgeons through the Arthritis Foundation can work in a much better way together and advance the future of musculoskeletal care rather than do it individually.
You know, in our recent reevaluation of our research mission, we changed it to include prevention, cure, and then eventually rehabilitation through the use of surgery. Obviously, in some ways, the need for surgery is a demonstration of our failure, even though extraordinary things happen here in this hospital for people who are bed-bound, wheelchair-bound, or not able to live the life they want to lead. So it really, this type of service lends itself so beautifully to use some of the newer, powerful medications, address the fact that a patient is not a joint, but is a whole organism in which a joint plays a major role in their limitation and function. And then those people who unfortunately either have bad disease or fail those therapies can be moved into the surgical suite in order to improve their lives.
Well, I think that's well spoken. And the other real strength of this service is that we sit together, rheumatologists, physical therapists, social worker, residents, both in orthopedic surgery and medical residents, rheumatology fellows, orthopedic fellows. We sit for an hour and a half to 2 hours a week discussing the problems, and we learn from each other. And I think that's a healthy thing. So on the education side, as well, the orthopedic surgeons in the room learn from their rheumatology colleagues, and I think the rheumatologists learn what orthopedics can do. And so I think it's a very healthy environment that's created on the service, both in terms of the patient care and then on the educational side, in terms of how we educate each other.
And over the years, research has arisen from these discussions, hasn't it?
Absolutely. I mean, we have, from this hospital and from this service, we have some of the real classic studies that were done on outcomes in rheumatoid arthritis, surgical outcomes, as well as many of the medical management for these more complex patients. We've looked at long-term results in our most severe rheumatoid patients in terms of infections and other complications. And we've done this with our rheumatology colleagues.
You know, it's interesting, Tom, that over the years, especially with our newer medications such as methotrexate and biological agents, the number of patients with rheumatoid arthritis needing surgery has decreased. And yet there is that spectrum and those people with more severe disease that continue to need our care.
No, I think you're right. I think the new remittive agents and particularly Embro, Remicade, some of these newer agents have really shut down the activity of disease in many of the patients. Of course, along with that come a subset of potential problems should the patient need surgery. And again, this is the kind of educational process that is important for the rheumatologist and the orthopedic surgeon. We certainly worry more about the potential for infection in that patient who is on immunosuppressants and maybe one of these new biological medications.
Do you find that the residents that come through hospital for special surgery, and they are quite special in so many ways, go forward and do likewise and try to stimulate this type of interplay and collaborative work wherever they go?
I think they do. I think sometimes in hospital settings there may be structural problems that may not allow the kind of collegiality that we have here. But certainly I think our residents leave here with an appreciation of the medical and surgical sides of the patient with rheumatoid arthritis and inflammatory arthritis, far more so, I think, than most other programs in the United States. And I think they see that the rheumatologists here collaborate not only in terms of the rheumatological care, but the medical care of the patients and the close relationships that we have when we work together with our patients. And I think they take that with them, and I think it does influence them going forward.
How do you see our study of outcomes as being helpful in this situation?
Well, I think, again, these are the most complex patients. And the outcome from the surgical management of these patients is influenced by many factors associated with their disease. So certainly when we look at the outcomes of a polyarticular involved patient with rheumatoid arthritis, the outcome is going to be far different in terms of function than it is an osteoarthritic patient who maybe has one joint affected. So certainly outcomes are important, but the outcomes are going to be much different as we go forward in these more complex patients.
And you believe until we find that cure or we find that immunization like in polio, that clearly patients will still need the multidisciplinary approach to their difficult problems?
Well, I mean, hopefully, your sphere will come up with some kind of medication or treatment or biological that will deal with patients with rheumatoid arthritis and prevent the progression of the disease. I mean, naturally, that's what we're all hoping for. But I think that that may be a far way off. We certainly have a lot of patients who have mechanical disease, which is the endpoint of their inflammatory disease, which is going to require care going forward.
You've had an extraordinary historical perspective on this institution, where it came from, what it's done over time. What is there about this institution that impresses you most?
Well, this is a very unique hospital. This is a very unique institution to work at, in that the thrust of the entire center, the entire hospital, is caring for patients who have musculoskeletal disease. Now, there are not 2 or 3 hospitals in the world that are as focused as we are. Now, since we do that, we are more efficient, we are more comprehensive, and certainly we are better at taking care of patients with the afflictions because that is what we do, and that's what we're focused in on doing. And that's what makes it a wonderful place to work and what makes it a wonderful place for a patient to come to. Because they're not coming to a large hospital, academic or non-academic, where there are general surgery patients and there are pediatric patients and there are all kinds of other disciplines, urological patients. This is a hospital, when you enter the door, the entire effort is focused toward that patient that has musculoskeletal disease, damage to joints and bone. And that's unique. You can't find that anywhere else in the world, or in very few selected places. Is that emphasis there?
So I think Tom has given you the concept of what this institution is all about. Obviously, until the cure comes, we will continue to focus on our patients in this multidisciplinary way, and also appreciate the fact that it's necessary to interact, to be collaborative, and also to communicate with our patients as well as physicians in our community.